Welcome all. Today's session is on suturing of wound, and this will be helpful to the students of post-basic BSc Nursing third year as well as certificate in community health program students also. As this is a skill unit, we will be covering in detail about the wound care and followed by the suturing of the wound. As you know that this is taken from the BNSL 209 or BNSL 43. The unit is there. As you know, the program has been integrated in post-basic BSc Nursing also, and both the program students will be benefited from this session. And in this session, as you know that the wound care is very important, and if the injury is not treated properly, then it can lead to various infections. It can lead to breakdown of the skin, as well as the healing will not be proper. So it is very important, and you must have seen that wound is can happen anywhere. It can be while the child is playing, or the someone is working with the knife and it get cut on the finger or on the face or eyelid, anywhere. So you can look after immediately. The care can be given, since you will be working in the grassroots level area in Ayushman Arogya Mandir, or you are working even in the hospital, those who are doing post-basic BSc Nursing. So they come across, you all come across wound here and there. So it is very important to take care of the wound. So we will be discussing in detail. As you know that lacerated wound require suturing and management. Also, if the wound is improperly sutured, it can lead to breakdown, it can lead to infection, and it can also lead to poor healing. So this is very important to remember, that if you will not take care of wound properly, it can lead to further complications, and patient will have to pay a lot for that. So the objectives of today's discussion are that after going through the whole discussion, you should be able to clean the wound properly. You need to give the stitches where required and does the dressing of the minor wounds. You should also know do's and don'ts of cleaning the wound as well as suturing of the wounds. And at the same time, when you are doing the follow-up, you can also supervise the wound at home setup, and you do the follow-up, and you also should be able to identify the danger signs so that you can refer the patient for proper treatment. So let us see the immediate care of the wound. As you know that all wound need some kind of cleansing, or we can also say toileting, because the simplest toilets or the wound which is on the eyelid or on the face or arm, it needs to be clean. So after you do the thorough cleansing with the help of, is done with the help of soap and water, and then followed by you can use some antiseptic and on the swab and do the dabbing. That dabbing means you touch the wound lightly, and usually you do the dabbing for several times. So whatsoever dirt was there in the wound, that can be removed. So after doing the ordinary washing, it has to be dabbed, and which will remove or explore to remove the obvious dirt if it is there. So most wound need more than this, and some need less than this. So that means you need to see what is the nature of the wound, whether it is minor wound or it is of a large size, or whether there is some drainage or whatsoever. You have to observe the wound first, and then you decide what care you want to give. The more the dead tissues, the more thorough must be your toileting or dressing. So that depends upon the wound. So dressing, when we say the dressing, it is a protective covering which is applied to the wound with some purpose. Why we need to protect the wound? It is needed to protect the wound, or we can say cover the wound, so that you can control if there is any present infection. It can also be if there is discharge or pus is oozing out of the wound, it needs to be absorbed. So that means you need to give the cushion cover so that wound keep on getting absorbed, that pus which is coming from the wound. It is also needed to control the bleeding. If the wound is having continuous bleeding, it is not being controlled, so you have to press it by the bandaging or dressing. So this is also one of the purpose, and also you need to do the dressing of the wound to avoid further injury to the wound. And there can be some of the contraindications also when you are doing the wound care. So this can be like if a wound is having foul smelling. So the foul smelling means there are bacteria or there can be other pathogens which have entered the wound and infection has occurred. So this kind of foul discharge is in case of vaginitis. It can be in the patients who are suffering with sexually transmitted diseases. So these kind of wounds are not to be dressed. They should not be covered, and you can identify the signs of infection in the wound, as it can lead to if the wound is there will be pain will be keep on increasing. So you ask the patient whether yesterday was more pain or today it is paining more. So that will give you some indication whether it is improving or not. So pain, then you can observe the wound and see whether it is having swelling or whether there is increase in the swelling, and at the same time there can be redness also. So these are the things or the danger signs which to be identified, and that can show that there is a foul smell, and this kind of wound does not require to be dressed or no need to cover. So more severe infection can also cause nausea as well as chills or fever. So these are the indications of danger signs in the wound if it is having foul smelling. So this kind of wound, it does not require dressing. Then lymphangitis, another important condition in which there is inflammation of the lymphatic vessels, and it is a possible medical emergency as the involvement of the lymphatic system, which allows for an infection to spread rapidly, because lymphatic system is this circulation of the lymph fluid which is circulating in the body, and through that circulation, if there is any infection, it will also circulate. So that kind of wound also does not need to be dressed. Then other condition in which you do not require to do the dressing or protect it, like it is the lymphadenitis. What is in case of the lymph nodes is getting swelled up. So this is called lymphadenitis, and in which you advise usually to apply a warm and wet compress, washcloth dipped in the hot water, and then you wrung it out, remove water from it, and it is hot. So that damp cloth you can apply on the affected area where there is sore, rather than doing the dressing. So take an over-the-counter painkiller if it is too much of pain, because it is too much of painful kind of lymph node swelling. So you can even advise for aspirin or ibuprofen in that cases, rather than doing the dressing. So now after knowing the indication of doing the dressing or the contraindications of the not to do dressing in some of the wounds, now let us see types of dressings. So there are various types of dressings, and this can be adhesive, it can be non-adhesive dressing, there can be gauze dressing, as well as the improvised dressings. So what is the adhesive dressing? You must have seen the band-aids, like these are the sterile dressing of different kinds. As you can see in the picture, some are very long, some are rectangular, and some is in a circular, usually used after the you take the sample of blood, and it has to be covered for some time to avoid that infection to cross the skin. So these are the sterile dressings of different kinds, and it consists of a pad of absorbent gauze, you must have seen. And to apply this, the surrounding skin must be dry before application, and all the edges of the dressings pressed from down. So when you apply the around the skin, it should be clean, otherwise it will not stick to that part, because it has to cover the part which is injured or having minor wound. Then other is the non-adhesive dressing. As the name specify, non-adhesive. So this is ready-made sterile dressing which consists of layers of gauze covered by a pad of cotton wool and with the attached roller bandage. As you can see in this, there is a dressing of the sterile, as well as there is a roller bandage which is to hold it in the position. So these are enclosed and sealed in protective covering, and these are also available in various sizes. So these are non-adhesive dressings. Then other is the gauze dressing. As you see, you must have seen, because you are working in the hospital, so the gauze is available, and in the market the gauze is available in the form of medicated sterile gauzes are available having medication on it. So these are used even for the minor cuts or the large wounds also, and is having the absorbent in it. So they are also soft and also very pliable, so it is liable to adhere to the wound. So when you remove this kind of dressing next time, so there is chances or likely that they may stick on the wound. So we will see that it has to be removed very gently when it has stuck on the wound. So you have to take care of that. So now another type of dressing, that is the improvised dressing. So this can be prepared with any clean, soft, absorbent material like the handkerchief or the piece of linen, any cloth available at home, or it can be used as a clean paper. Nowadays, tissue or the wet tissues or even medicated tissues are also available to clean the wound. So as you see in this picture, like a SOHS can be cut out to be used as a crepe or the pressure constriction bandage, as if the patient needs to immobilize the part, maybe he got a fall and there is pain in the hand, to immobilize that part to cover that part if there is no wound. So you can improvise and use the whatsoever available. Why it is important? Because you are in the grassroots area working, maybe in the rural area, so there you may not get sometime the roller bandage or adhesive or non-adhesive tape. So you can improvise and use the best what is available. Now let us see the points to be kept in mind while doing the dressing. So an efficient dressing should be done. It should be, you have to maintain the aseptic technique. So it should be sterile whatsoever condition, and you need to wash hands thoroughly before the dressing. Avoid touching of the wound with your fingers. That is why we say, even if your hands are washed many times but they remain dirty for the wound, so you need to wear the gloves and use aseptic technique. Do not talk or cough open over the wound. So if you are having cough or sneezing, it should not be on the wound. So it can give additional infection. And if the dressing stick to the wound, do not try to pull it, but remove gently by wetting the wound with the sterile normal saline solution. So once you have wet the wound with the help of sterile normal saline solution, it will get soft and then it can be removed easily. So there are various articles which are required to be used. You have to prepare the articles as you do for every procedure. You prepare articles, so you need to prepare the article before doing the dressing, using kidney tray or paper bag, Savlon or Dettol, forceps, syringes, scissors, medication in case any ointment to be used on the wound, and spirit as well as the gloves. So we have covered up to the wound care and the types of dressings which can be used. Now let us see the dressing of the wound, or how to clean the wound. Like social cleansing of the wound, that can be done anywhere the patient is there. So that is you need to pack the patient's wound with a sterile swab. Where there is wound, on that wound you will keep a swab so that you cover it, and then around that area, and you will wash the skin or clean the skin around it with the tap water and soap, rather than using some dirty water from here and there. But you need to use clean water. And if you have if the wound is having more dust and more dirty, so you can use the nail brush until the skin is clean. Then if the dirt is ingrained, if there is more dirt on the wound, then you can use a soft boiled nail brush with gentle rotating the movements and gloved or scrubbed hands. So then if you are going deep in cleansing the wound, you have to use the boiled brush or the in rotating movement, and either use scrubbed hand or the gloved hands. Then do not use vigorous side to side scrubbing. As we told, you have to do it in the circular motion rather than side to side scrubbing movements. So avoid that. Then put a basin under the wound and pour clean water over it continuously. It is very important to clean the wound, and clean the wound using tap water, soap, or you can use the water and basin and put water to clean the wound. After that, surgical cleansing of the wound. There is difference between the two. First I told you social cleansing, that you will use soap and water, cover the wound, and around the wound you will do the cleansing of the skin and with using tap water, soap, etc. Now you in the surgical cleansing of the wound, you paint the skin around the wound with cetrimide or chlorhexidine. These are available in the health setup, but don't use iodine because it can damage the tissues of the wound rapidly. And you drape it or cover with the clean cotton, only exposing the wound. So you need to keep the points in mind while cleansing the wound, like treat the tissues very kindly. Don't do in haphazard manner, or gently you have to clean the wound so that you do not give more damage or to the patient by your cleansing. And don't grab them with the large artery forceps. If the wound is small and you are using some instrument which is going to give more harm to the patient, so that will be not good for the patient. Or you can swab do not swab violently. If you will put a swab in forcefully, you will give more damage to the patient. So this give more injury and makes them less able to resist infection. And not only that, you are damaging the tissue, at the same time you are giving more infection to the patient by giving the violent or not handling the wound gently. Use a pair of forceps to wash away all dirt and ingrained mud. If patient can come in any of the condition, if there is mud or dirt or whatsoever and wound is there, it is you have to clean it using depending upon the condition of the wound. Then you flush smaller foreign bodies, if there is any foreign body out of the wound, with sterile normal saline. This is the best solution, and you should use sterile only. Sometime the leftover bottle is lying of normal saline and you see that it is normal saline, but it was punctured, it was used before, maybe it is contaminated. So you have to take care that once you are using normal saline to clean, because it is a surgical dressing, you have to avoid infection. So be conscious in taking only sterile normal saline or sterile water. And you can do even syringing with the 50 ml of syringe, or in ear syringe also can be taken, so that you give a flush of water or normal saline to the wound, so that deeply it will clean the wound. And if you can also find in a wound like pieces of wood, pieces of metal or gravel, or sometime the clothing. So you have to see what is there in the wound with which it is contaminated, maybe mud, dirt, cloth or wood, metal, anything. So because injury can be caused with any of them. So you have to be very gentle, and you only expose the patient's wound and probe for the foreign material, which is all these are foreign material to that wound. So you have to explore and you remove all this foreign material. If necessary, open it widely to look into its depth. Depending upon the facilities available with you and depending upon the condition of the wound, how much is possible from your side to do in that wound, because you are not going to give more injury or further infection to the patient, rather than you want to take care or manage the wound efficiently at your level. Then if for any reason a foreign body is left in the wound, such as it is deeply embedded, it can be a bullet injury which is deeply embedded in the wound, and then tell the patient so that it is a very deep wound. You have to inform the patient and remove all the clots and join up all the cavities so that they drain easily. So you will not just close that wound tightly, because it can lead to further infection. So you will inform the patient, as well as you will remove the clots around that wound, and you will not fully cover it so that it gets joined, because that bullet has to be removed, and it will be removed with the help of surgery in the higher health facility. Then you assess the condition of the wound, and patient may be referred to higher facility, like injured skin, or in case in the wound there can be injured fats, so that can lead to necrosis. So you cut it back freely until you reach the healthy yellow fat which is not bruised. So you have to see how deep you can go in giving care to the patient, depending upon the level of injury in the wound. So there can be even injured muscles and injured fascia which you have to observe. So you can do the cutaway of all the dead muscles, and dead muscles look darker and bluish. You have to observe, because when there is blood supply disturbed, then they will be having bluish discoloration, and it does not bleed or ooze when you cut it, and it does not contract when you pinch it with the forceps. So you have to see the how much is possible from your side at that facility which you can do for the patient. Then you in case if there is any loose pieces of the bone, you have to observe, patient might come with such kind of injury also. If loose pieces of bone which are not attached to the periosteum of the muscles, then they are ischemic and will die and anyway, because now blood supply is cut off from for these pieces. So you can remove these broken pieces of the bone which are available, and leave the bone pieces which will still attach to the periosteum. So in this unit we have covered the care of the wound, how to clean the wound, what all points you have to keep in mind while cleansing the wound, so that you does not give further injury to the patient, and you can manage at the primary healthcare setup level. With this, I conclude. Thank you.
In the digital revolution time,